How to cure breast cancer like a pro. Breast cancer is a complex disease, and finding a cure requires a comprehensive and multifaceted approach. While I can provide a brief overview of various treatment modalities, it's important to note that a complete cure for breast cancer depends on many factors, including the stage of cancer, its characteristics, and the individual's overall health. Here's a condensed explanation of breast cancer treatment options. Early detection. Early detection plays a crucial role in improving breast cancer outcomes. Regular breast self-exams, clinical breast exams, and mammograms can help detect breast cancer at an early stage when treatment is most effective. Surgery. Surgery is often the first line of treatment. It involves removing the tumor and nearby tissues. A lumpectomy removes only the tumor and a small portion of surrounding tissue, while a mastectomy involves removing the entire breast. In some cases, lymph nodes may also be removed. Radiation therapy. After surgery, radiation therapy may be used to kill any remaining cancer cells and reduce the risk of recurrence. It involves the use of high-energy X-rays or other particles to target and destroy cancer cells. Subscribe for more videos. Chemotherapy. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. It may be administered before surgery, neoadjuvant chemotherapy, to shrink tumors, or after surgery, adjuvant chemotherapy, to eliminate any remaining cancer cells. In some cases, chemotherapy may be used for advanced or metastatic breast cancer. Hormone therapy. Hormone receptor-positive breast cancers rely on hormones like estrogen or progesterone to grow. Hormone therapy involves the use of medications that block the effects of these hormones or reduce their production. It can help slow down or stop the growth of cancer cells. Targeted therapy. Some breast cancers have specific characteristics that can be targeted with medications. For example, HER2-positive breast cancer can be treated with drugs like trastuzumab, Herceptin, that specifically target HER2 protein, slowing down cancer growth. Immunotherapy. Immunotherapy harnesses the power of the immune system to recognize and destroy cancer cells. While it has shown promise in some cancers, its role in breast cancer treatment is still being researched and is not yet considered a standard treatment. It's essential to remember that breast cancer treatment is highly individualized. The best approach is to consult with a team of healthcare professionals, including oncologists and surgeons, who can assess the specific situation and develop a personalized treatment plan. Additionally, advancements in research and medical technology continue to improve breast cancer treatment options, emphasizing the importance of ongoing medical advancements in the search for a cure.